If your MRI says C5, C6 disc bulge, and someone told you that it'll just heal on its own, you need to watch this first. Because the answers to how long it actually takes depends entirely on one thing, and most people get it completely wrong. In this video, you're gonna find out exactly how long a C5, C6 disc bulge actually takes to heal. So keep watching. Hi, I'm Dr. Paul Barnwell, chiropractor here in Katy, Texas. If you're dealing with neck pain, pain going down your arm, or numbness and tingling into your hands, and you've been told that it's a C5, C6 disc bulge, then you're probably wondering one thing. How long is this going to take to heal? The answer depends on where you are in the process. And today, I'm going to walk you through step by step so you know exactly what to expect and what you should be doing next. Now, before we talk about timelines, you need to understand what is actually happening in your neck. Your cervical spine is made up of 7 bones labeled C1, so cervical 1, through C7. The C5 and C6 vertebrae sit in the lower part of your neck, and this is one of the most mobile and stressed areas of the entire spine. Between those bones is a disc. This disc acts like a cushion. It absorbs pressure and allows your neck to move properly. A disc bulge happens when the outer layer of that disc weakens and the inner material starts to push outwards. So this is not just pain, this is a structural change in the disc itself. Now, here's the part where most people are never told. What actually causes this to happen? Sometimes it's a traumatic event. That could be a car accident where your head is suddenly forced forward or backwards. It could be a fall. It could be a sports injury where there's direct impact to your neck or your head, but that's not the most common cause. The most common cause is something much slower. It's the gradual breakdown of disc over time due to poor posture and abnormal spinal alignment. Let me ask you this. Do you spend hours looking at your phone or sitting at a computer? We all do to some extent. Over time, that forward head position increases stress on the C5, C6 level. This constant pressure weakens the disc little by little until eventually it begins to bulge. So for most people, this didn't start yesterday. It's been building for months or sometimes even years. And that's exactly why the healing timeline is not the same for everyone. Now let me ask you this. Is your pain just in your neck, or do you feel it travel down into your arm, maybe even into your thumb or index finger? That pattern is not random. At the C5, C6 disc level, the disc sits right next to the C6 nerve root, and when that disc bulges, it can press on or irritate that nerve. That nerve then travels from your neck into your shoulder, down your arm, and into your hand, which is why you can experience neck stiffness, shoulder pain or discomfort, radiating arm pain, numbness, tingling, or even weakness in your grip. In some cases, you may not feel much neck pain at all, but instead feel pain, tingling, and numbness only in your arm or hand, and that can still be coming directly from a C5, C6 disc bulge. This is called cervical radiculopathy. Here's something very important that most people are never told. If your symptoms are traveling further down the arm into the hand, that often means the nerve irritation is progressing, and this is something that needs to be addressed early before it worsens. What we want to see during recovery is the opposite pattern. We want to see the symptoms start to centralize, meaning the pain and the tingling begin to move out of the hand, out of the arm, back up towards the neck, which is the source of the problem. That shift is one of the clearest signs that the nerve is starting to calm down and heal. Now, here's where many people get confused. If your symptoms improve, you might assume the problem is gone. Pain's a great motivator, but symptom relief alone does not always mean that the disc has fully healed. So why can this not just heal in a week or two? And it comes down to biology. Spinal discs have a very limited blood supply, which is very different from muscles that receive a rich flow of oxygen and nutrients to support fast healing. Because of this, a disc cannot repair itself quickly. Instead, it relies on a slower process where movement and pressure changes help draw nutrients into the tissue, similar to how a sponge absorbs fluid over time. Now add ongoing stress and compression to that environment and healing becomes even more delayed. If the pressure on the disc is not properly reduced, the healing process can slow down significantly or even stall altogether. At the same time, the nerve that has been compressed or irritated also needs time to recover itself, especially if that compression has been present for weeks or months. So you're not just dealing with a disc that needs to heal, but also a nerve that needs to settle and regain its normal function. So that combination is exactly why this process takes time and why the right approach early makes such a huge difference in how fast and how complete your recovery will be. Let's start with the best case scenario. If your symptoms started less than a month ago, you're in what's called the acute phase. And this is where your body is the most responsive to the right type of care. With proper targeted treatment, most patients begin to notice meaningful relief in their symptoms within 6 to 12 weeks, especially as inflammation starts to decrease and pressure on the nerve begins to reduce. But here's the key point that many people misunderstand. Just because your pain improves early does not mean the disc itself has fully healed. In most acute cases, true structural healing of the disc typically takes about 3 to 6 months, assuming the pressure is being properly addressed and the spine is being supported correctly. If you stop care as soon as you feel better, you're leaving the disc in a vulnerable state, which means the next time stress is applied to your neck, the symptoms can return just as quickly as they went away. This is why early improvement is a good sign, but it should not be mistaken as a full recovery. Now let's talk about the next stage. If your symptoms have been present for more than 3 months, your condition is now considered chronic, which means your body has had time to adapt to the problem in ways that actually slow down recovery. The nerve has likely been irritated for a longer period of time, the muscles around your neck may have tightened to protect the area, and your movement patterns may have changed in response to pain. All of this creates more stress on the spine and makes the condition more complex, unfortunately. At this stage, patients can still make very strong progress, but the timeline is longer and requires more consistency. Most cases in this category take between 6 to 9 months of focused corrective care to see true structural improvement and lasting symptom relief. Now here's something important to understand. Progress in this phase is not always linear, which means you may feel better for a few days and then have a flare-up and then improve again. That pattern is normal. What matters is the overall trend over time, not how you feel on any single day. This is where many people get discouraged and stop too early, but if you stay consistent and you address the underlying cause, the body can still heal and recover without surgery. Now let's talk about the stage where most people start to lose hope. If your symptoms have been present for more than 12 months, this is considered long-term chronic. And by this point, many patients have already tried different treatments, obviously without any lasting results. You may be thinking that this is permanent or that surgery is the only option left. That's not necessarily true, but the approach and the timeline do change. At this stage, the disc has been under stress for a long time. The nerve has likely been irritated for an extended period, and the spine has adapted structurally in ways that need to be corrected. Because of that, healing becomes a longer process. Most cases in this category require a structured correction plan over the course of 9 to 12 months to achieve meaningful, lasting improvement. The focus here is very specific. You need to reduce the pressure inside the disc, take the compression off the nerve, and begin restoring proper alignment and movement in the cervical spine. This is not about quick relief anymore. It's about rebuilding function and stability over time. Even in long-standing cases, recovery is still very possible when the underlying cause is addressed correctly and consistently. Now, here is what most people are never told early enough. If the problem is pressure inside the disc and compression on the nerve, then the solution has to address both of those directly. One of the most effective non-surgical methods for C5, C6 disc bulges is spinal decompression, specifically cervical decompression. This is not stretching your neck or doing exercises. This is controlled, targeted. It's designed to gently separate the vertebrae in the neck to reduce pressure where the problem actually exists. When this is done correctly, it creates a negative pressure inside the disc. That negative pressure helps draw the bulged material back towards the center of the disc, which directly reduces the stress on the outer wall of the disc. Remember, that's where the failure was to begin with. At the same time, this process reduces the compression on the C6 nerve root, which is what helps relieve the pain, numbness, and tingling that's traveling down the arm and into the hand. So now you're not just masking symptoms, you're actually changing the environment that caused the problem in the first place. This is how many patients begin to experience real lasting relief, especially when the approach is combined with corrective exercises and proper spinal care. Of course, this type of treatment should always be done under the guidance of a qualified healthcare provider to make sure that it's appropriate for your specific condition. You now know what a C5, C6 disc bulge is, why it causes the symptoms you're feeling, and how long it actually takes to heal based on how long you've been dealing with it. No matter what stage you're in or what your timeline looks like, whether it's acute, chronic, or something you've been dealing with for over a year, I don't want you to lose hope. I've seen many patients with C5, C6 disc bulges from all types of clinical histories respond very well to non-surgical conservative care when the right approach is used. So stay consistent, stay patient, and do not give up on your recovery. Look for a chiropractor who has experience with spinal decompression, specifically for cervical spine, and find out if it's a right fit for your situation. And if you have any questions or want to share your experience, leave a comment below. And if you know someone dealing with neck pain, arm pain, or numbness and tingling in their hands, share this video so that they can better understand what's actually happening and what they can do about it. Subscribe to my channel if you want to better understand your body, reclaim your health, and get practical, actionable steps that you can use right away to move toward a life with less pain and more purpose. If you want to see the 5-step process I use to treat C5, C6 disc bulges, including cervical decompression, and how it's helped patients recover from even chronic cases, watch this video next.